Hi, my name is Wayne Centrone. I'm the founder and executive director of Health Bridges International. I want to start by thanking you for choosing to spend some of your valuable time, learning more about Health Bridges International and our work to build bridges of collaboration to advance health within extremely impoverished and marginalized communities of women and children. It's been 4 months now since the declaration of national states of emergency and the corresponding lockdown measures. The pandemic has had devastating impact on the developing and middle income world. This is especially true in Peru, where it's estimated 70% of the workforce is employed in the informal sector. If you work, you get paid and eat. If you don't work, you go hungry. According to the United Nations and a special report released in early July, the coronavirus pandemic has led to the worst recession in Latin America in over a century. Fears are this recession will push the number of people living in the experience of poverty up to over 230 million. And the number of people living in the experience of extreme poverty will increase by 28 million to almost 100 million. Look, Latin America was already, well before the coronavirus pandemic, one of the most unequal regions in the world. And the differential impacts of the COVID-19 pandemic are making this situation much worse. The sharp drop in economic activity is expected to lift unemployment from 8% to well over 14%. And this is disproportionately impacting the lives of women living in the experience of poverty. Women are overrepresented in poor households in the Latin American region. This pandemic has had devastating impacts on their lives. It's had impacts on food insecurity, where it's estimated there's been a threefold increase in the number of people requiring food assistance. According to the World Food Program, 12.5 million people are moderately food insecure, and an additional 3.5 million are severely food insecure in Peru. This brings the total number of estimated people living in the experience of food insecurity to over 16 million. That's nearly half the Peruvian population. Look, if food insecurity weren't terribly troubling enough, experts estimate the global fatality rate from COVID-19 will reach between 40 and 60 million people. This will inevitably leave many children without a parent or caregiver. Child welfare experts fear the number of abandoned children in response to the pandemic will overwhelm care settings and lead to even more uncertain futures. Look, this is a crisis by any measure, and it is a time for action. Before I leave you, let me tell you the story of a boy who came to live in one of our Casa Solis homes during the pandemic. By all account, Alex's life, Alex is not his real name, was hard even before the pandemic. Food insecurity, economic poverty, these things plague the family. Adding the pandemic to the baseline economic fragility and underdiagnosed and untreated mental health conditions in his mother, and the family was at a situation where bad went to worse very quickly. When he came to live with us, the first photograph I received was of a shy boy, uncertain where to stand to have his picture taken. What I later found out was this small boy had come to our home under terrible conditions of abuse. The coronavirus crisis had stretched what meager coping skills the mother could recruit in her life, and she broke. She beat, burned, and tormented Alex. Look, his coming to us, it's the start. It is the start to develop a pathway for healing. It is the start to develop a life he deserves, a life that will support him to build the resiliency and healthy attachment that will guide him to the future that he desires. But you see, our work, this work, it can't stop with Alex. We have a responsibility to reach further, to build bridges of support, to help his mother, to help his family, to help them gain access to the knowledge and skills they need to foster better relationships and create deeper attachments. We have a responsibility to help families find the wholeness they deserve. Coronavirus, it's exposed all of the terrible inequality and inequity in the world. People who before the pandemic were suffering to find the services and supports they needed are now desperate and in deep trouble. Poverty should never separate a child from their parent. And yet the profound economic impacts of the global pandemic, they're separating thousands, hundreds of thousands of children from their families. But here's the thing. We can help. We can make a difference. We can change the life of Alex. We can help his mother find the services and support she needs to rebuild her life and the lives of her children. But all of this, it takes resources. It takes people. It takes time. So here I am to ask for your resources. Quite frankly, here I am to ask for your money. Because we know with your resources and your support, we can and we will change the lives of thousands of children like Alex. This is an incredibly challenging time. And the only real course of action we have is to work together to ensure that every child, every mother, every person has access to the opportunity they need to build the futures they deserve. So thank you. Thank you for joining us. Thank you for learning more about who we are as an organization. And thank you for building bridges. With your support, we can and will change the world.